Just don't pull it over on us. What?
You may set your bags just inside the door there. No harm will come to them. If anything goes missing at Palama, it's usually because a child has mistaken it for sporting equipment. Let us gather here on the porch for a moment. You are the new volunteers, am I correct? Excellent. We are glad to have you. Before I hand you over to the nurses, club directors, and educators who truly run this place, I invite you to take in the view from this porch. From here, one can see almost the whole business of the settlement unfolding at once. There, in the gymnasium, boys and girls who might have otherwise drifted toward trouble are instead engaged in teams, competitions, organized activity. There, beyond the palms, is the dental infirmary, where every youngster born in Honolulu between 1925 and the early 1940s had their turn in the dental chair. Why, at one point, the Strong Carter Dental Clinic was practically synonymous with the settlement itself. But Pālama Settlement did not begin as a settlement at all. When Peter Cushman Jones founded Pālama Chapel in 1896, this district just to the west of Honolulu was already changing rapidly. Once Palama was almost rural, with duckyards, taro patches, fish ponds, and even sugarcane. Queen Liliuokalani had a home here, Mu'olaulani, a place where she could form closer relationships with her neighbors without the stately formality of the palace. But as Honolulu grew more urban, so did Palama. P.C. Jones and his wife, already well known to the community through their teaching at Kauai and Central Union churches, as well as at the YMCA, enjoyed spending their afternoons driving through the streets of Palama. But they quickly realized that there was no center of worship in the neighborhood. People had to walk at least a mile to the nearest church. They also observed groups of boys hanging around street corners with idle hands. Seeking to address both of these issues, Jones purchased land at the corner of Liliha and King Streets and opened up a branch of the Central Union Church to serve this community. Pālama Chapel flourished immediately, focused on improving the character and education of the young people in the district. Besides church services and Bible study, they also formed a boys and girls club, as well as a choral society and a sewing circle that soon followed. But the most important development was the kindergarten, because teachers quickly observed that students were arriving hungry, poorly clothed, or with untreated infections. And so volunteer nurses were brought in to bathe children, treat sores, and check for signs of illness. This movement from from missionary chapel rather, towards social institution was greatly accelerated after the Chinatown fire of 1900. On December 12, 1899, a bookkeeper on Nu'uanu Street was pronounced dead from the bubonic plague. Before nightfall, 5 more deaths had been confirmed. Terror gripped the community as the number of cases multiplied, and the Board of Health, desperate to contain the epidemic, began conducting controlled burns of infected structures. On January 20th, 1900, one of these burns spiraled out of control. Flames leapt between wooden buildings faster than anyone had anticipated. Families fled, carrying whatever belongings they could. Thousands were displaced instantly, scattering into the adjoining districts. Palama swelled overnight. Temporary housing became permanent overcrowding, and the district grew poorer and denser, younger and more transient. Tenements were erected quickly and haphazardly. Heaps of garbage lined the lanes, and the lack of sewer connections turned soil into muck, the perfect breeding ground for disease. Amidst all of this, Pālama Chapel struggled to be maintained by Central Union Church, and so they turned to the Hawaiian Board of Missions for help. This was the Palama that greeted me. But perhaps I should acquaint myself to you more fully. I am James Arthur Rath, born in Hyderabad, India, in 1870. My father was a British Army surgeon, and I spent my younger years between military schools, government service, and then working with the YMCA in Bombay. I studied at Springfield College in Massachusetts, and that was where I met Ragna, a school teacher in nearby Concord. You shall hear her name quite often around here, and quite rightly too. Pālama Settlement would not exist in its current form without her. Ragna and I were married in October of 1904. And shortly after that, we were approached by Doremus Scudder of the Hawaiian Board of Missions to come to Oahu and take over the Palama Chapel. The board was looking for a married couple who would live permanently among the people rather than simply preach to them. Ragna and I arrived here on March 1st, 1905, with the intention to stay for 5 years, but that deadline would be extended many times over. Now, the settlement house movement had begun in places like London's Toynbee Hall, but the Americans had grasped it with their usual enthusiasm and began building settlements everywhere. The idea was radical for the period, that poverty, disease, and delinquency were not failings of morality, but rather the consequence of overcrowded cities with poor sanitation, dangerous labor conditions, and lack of recreation. Therefore, if one wished to improve civic life, one must first improve the social and physical conditions of the people living there. I set to this with a fervor. Within the first year, I transformed the chapel into a settlement modeled after Hull House in Chicago, and in 1906 we were officially renamed Pālama Settlement with an independent board of trustees. At first, people were suspicious of our efforts. Who were these howly reformers coming in with clipboards and opinions? But given time, suspicion will turn to curiosity, and curiosity can become confidence. My wife Ragna understood this. She went directly into homes, bringing food and sitting with mothers. She taught hygiene, arranged for schooling, and comforted frightened families. Somehow she also managed to raise our 5 children at the same time. Years later she laughed that settlement work was harder than being a minister's wife because they don't call ministers up in the middle of the night to come get boys out of jail. Meanwhile, I became fanatical about sanitation. Ragna would say obsessed. I tell you, tenements were a menace to society, and conditions in parts of Palama were absolutely appalling. When my complaints to the Board of Health went unheard, I wrote an article for the newspaper and conducted a tour of the city, a tour of the area for the city officials so they could see with their own eyes the pest colonies and drainage ditches filled with stagnant water and rubbish. If one wishes to improve the city, one must occasionally inconvenience respectable men. I also believe strongly in organized athletics. I maintain that physical recreation can prevent as much misery as moral instruction, and so I devoted many hours to coaching youth sports. The gymnasium was important because boys who spent their evenings boxing or playing ball were not out roaming the streets after dark. The swimming tank opened in 1909 and soon became one of the best known parts of the settlement. Duke Kahanamoku himself swam exhibitions there. Now, unlike most institutions of the period, Pālama Settlement brought Honolulu's various social classes into proximity. Wealthy trustees visited a district they would have otherwise ignored. Doctors volunteered at the clinic with families they would never have met elsewhere, crossing boundaries of language and ethnicity. Children from crowded immigrant households were engaged in athletic competitions and public events that gave them a visible place within the city. Portuguese and Filipinos were desperate to learn better English to improve their opportunities, and so we opened reading rooms. Japanese laborers wanted night classes, so we taught typing, stenography, and English. the settlement became a crossroads where the whole city encountered itself. It has also been remarked that modern medicine is largely a matter of organized attention. And we soon turned our attention to developing medical programs. Pālama Settlement pioneered neighborhood-based preventative health care long before it became standard public policy. Our nurses conducted thousands of home visits annually, reaching out to working class and immigrant families, and then following up month after month. Mabel Smythe, the director of our nursing program, created a prenatal clinic at the settlement, as well as the ones at Queen's Hospital and the maternity home. There, mothers were instructed in sterilizing bottles and urged to have hospital births, reducing infant mortality. Her staunch advocacy helped to move Hawaii from a model of charity-based medical aid toward organized public health systems. Another major force in the area of medical care arrived in the form of Dr. Niels Larsen, born in Sweden in 1890. Dr. Larsen arrived just as my time at Palama was ending. He came to focus on tuberculosis, which had plagued Honolulu for decades. Larsen's own sister had died from the disease, and so he worked intently to prevent that same pain and suffering in others. But what made Larsen especially unusual was that he questioned establishment opinions, arguing that Western medicine had unfairly dismissed Hawaiian healing traditions. He studied medicinal plants such as olena and noni, and defended lomi lomi and other practices of kahuna la'au lapa'au. He realized an essential truth, that neighborhoods survived not merely through the intervention of outside institutions, but through the knowledge already rooted within them. Dental care also became a settlement priority, after surveys revealed severe oral health problems among school children. Some of them were unable to eat properly because of untreated infections. Well, dentists began volunteering at the dispensary in 1914, and within just a few years we established the dental infirmary. By 1915, our work had expanded far beyond the little old chapel. We created the Fresh Air Camp in Waialua on the North Shore, based on an idea first glimpsed in the pages of Life magazine. That article extolled physicians' new belief that exhausted children and mothers needed rest, ocean air, and respite from crowded cities. If anyone doubts the need for such a place, I invite them to visit Palama, Kalihi, or Kaka'ako in the summer and watch the little mothers of the tenements trying to soothe tired, fretful children longing for a gasp of fresh air. Money was raised so a kitchen, dining hall, and 12 sleeping cottages could be built on the grounds of the old Haleiwa Hotel bathing beach, owned by Bishop State. There were a few shade trees, but Miss Lucy Ward generously donated palm fronds from old plantation, and so a covered pavilion was built that provided ample protection from the sun. I still remember seeing the mothers boarding the train. Once at the camp, they sat under the pavilion in wonderment, because this was the first time in months they were not surrounded by noise and worry. You cannot understand what rest truly means until you encounter people who have not had any. I myself need a rest occasionally. One time I went to stay at the Fred Baldwin Memorial Home on Maui, while also helping out with some early management issues there. After that first year of the Fresh Air Camp, we received a list of 800 children for whom it might prove beneficial, nominated by doctors, nurses, and public schools. Each new phase of the settlement's work was in response to the needs of the community. And as our services expanded, so did our facilities. By the early 1920s, the original chapel buildings were no longer adequate for the scope of operation. And so we undertook construction of a major new campus on Vineyard Street. Fundraising occupied enormous portions of my time in those years, but in 1925, the new Pālama Settlement campus officially opened. At the dedication ceremony, Mayor John Wilson remarked that Honolulu could scarcely afford to replace the services that Palama had already provided. And now we had clean, white buildings with great open spaces for lawns and playgrounds, and a glistening tile swimming pool with a 3-tiered diving tower. There is the medical center with an emergency unit, baby clinics, dispensary. Over there, the administrative building houses offices, club rooms, a library, an auditorium, and a new and improved gymnasium and athletic field. At the time of its opening, this was perhaps the best equipped social center in the United States. I must confess that opening day moved me deeply. One labors for 20 years listening to people explain how every proposed improvement is impossible, impractical, too expensive, too ambitious. Then one day, children are walking through the buildings those critics said could never be built. Given my naturally sober disposition, people often ask, "Don't you ever smile, Rath?" Well, let me assure you that on this opening day, that question was not uttered. In the 121 years of Pālama Settlement, many things have changed around here. No longer are circuses hosted on the athletic field, but the pickleball courts are in heavy use. Typing lessons have been replaced by digital media classes. And the swimming pool, once the jewel of the community, now lies paved over by an expansion of Vineyard Boulevard. I myself passed on in 1929, but Pālama Settlement has continued to evolve. In recent years, many of the public health programs have been taken over by government agencies, while the settlement has focused more on youth services, counseling, recreation, neighborhood organization, and community support. With every new generation comes new challenges, but Pālama Settlement has adapted to meet each new challenge head on. These buildings keep changing, but the community remains, and the needs of the old and the young are as urgent now as ever. We must continue to respond to that call. Mahalo, and aloha.